Okay, thank you, Maurice. It's a pleasure for me being in Luxembourg. In fact, it's usual that I am in Luxembourg because the unit in charge of the neurodegenerative diseases in the European Commission is located here in Luxembourg. Also, Alzheimer Europe is located in Luxembourg, and today this conference is also taking place here in Luxembourg, and I'm really happy and proud that Luxembourg is becoming a so important reference for Alzheimer in the world. Of course, my task today is to explain you what the European Commission, what the European Union is doing in the field of Alzheimer. It will be very pretentious from my side to say that always, since the beginning, during the whole history of the European Union, the European Commission has been very active in the field of Alzheimer. In fact, we have very recently celebrated the 50 years of the creation of the European institutions, but we are not certainly in position to celebrate 50 years of European public health. The European public health is something more recent in the European Union. It starts only in 1996, when it's the first time that the Treaty of Maastricht mentioned for the first time public health as being a field of action of the European Commission. And practically in 1996 is when, for the first time, the European Parliament, if you remember, for the first time has done a written declaration asking the European institutions to do some actions in the field of Alzheimer. 1996 is the starting point, and the real new starting point when finally the European Commission decides to take important actions in the field of Alzheimer is 2008-2009. Then it's a relatively recent policy, which not means that during all these years nothing has happened. From one side, we know very well that we are facing a very serious problem, that we are facing the problem of dementias in general, not only Alzheimer, but also the Pick's disease, the vascular dementia, the Bieswanger disease, the Lewy body, etc. That we are facing this on the basis sometimes of insufficient data to know exactly what is happening in the European Union, and this with the cooperation of Alzheimer Europe, and as a result of the Eurocode project that now we are able more or less to estimate finally that the number of Europeans in the 27 member states affected by a dementia is 7.3 million, which is something significant and enormous. We know very well that that will be something increasing in the coming times. Is in this context, for the first time, that really in 2007, in the document called the European Health Union Strategy, a better understanding of the neurodegenerative diseases such as Alzheimer and other dementias appears for the first time as an important point in public health terms to be addressed. By chance, the European Commission had also the FP, the Framework Programs for Research, that during years and years, and especially in the seventh one, for the period 2007-30, have placed the research on brain-related diseases and, in general, neurological diseases as a priority. What we have done for the first time in order to start the real basis of information for proposing one day a serious policy at European level, it was to finance in 2005 the project called Eurocode, European Collaboration on Dementia. This project, coordinated by Alzheimer Europe, has been an enormous success and has been an enormous influence in all the developments later at the level of the Council, the European Parliament, and the Commission. And really, as Alzheimer Europe, you can be very proud that really in the origin of a lot of the actions that are being done now by the European Commission, Alzheimer Europe is in the starting points. The results of Eurocode are an important output, an important influence for producing the results that now we can more or less present. It has been also years in which Alzheimer Europe, with the support of the European Commission, started the publication of the Dementia in Europe yearbook, 2006, 7, 8, and 9, and I suppose very soon, the 2010. It's also the time in which the written declaration of the European Parliament in January 2009 calls for putting Alzheimer's disease as a priority. And it's also the moment in which the French presidency, and that was in December 2008, decided for the first time to propose to the Council of Ministers of Health of the European Union to adopt what is called Council Conclusions. Council Conclusions is a document that it's really important. Really, it was during the French presidency, and I think that we should mention this, a personal commitment of the French President de la République, who really pushes the Commission and the Council for adopting these conclusions. And this document of conclusions in December 2008, in which Eurocode is mentioned, in which all the previous works are mentioned, is in the origin of the things that later produces a very important result in 2009, this 22nd July, which is the adoption of a Commission communication addressed to the Parliament, the Council, on a European initiative on Alzheimer's disease and other dementias. A Commission communication is a document in which the Commission simply says, me, European Commission, I will do this, and I communicate to the other institutions, Parliament, Council, Social and Economic Committee, what I will do. And during the discussions of these documents, the Council conclusions and the Commission communication, it was selected a series of consensual priorities accepted by the Member States and accepted by the Commission. These priorities are essentially the prevention, are essentially the early detection, are a common approach for rights, autonomy, and dignity for people suffering from dementias. And as a result of this, also, it was in parallel adopted a very important initiative that was what is called the joint programming in Alzheimer's disease. Joint programming, as the name indicates, is that the member states recognizes that individually, not every member state is able to do all what is necessary in the field of Alzheimer's disease, and that was necessary a coordination in the field of research. To implement these initiatives, there are two expressions that probably you should now more or less remember. One is joint action, and the other is joint programming. What is exactly a joint action? A joint action is an instrument that exists in the health program of the European Union, and joint action is also exactly what the name indicates, joint action between member states and European Commission. 50% of financing, 50% of responsibilities. What has been decided to implement the objectives in this Commission communication is to put in place this joint action. This joint action has been signed very, very recently after a process of selection and discussion between the member states. We will refer to the content later. But what is essentially objectives of this European action is to improve, for instance, the quality of the epidemiological data on Alzheimer's disease and other dementias. We know this figure of 7.3 million, but really we know all about the prevalence and the incidence of Alzheimer's diseases? Probably no. We need to know more. And this should be a common effort at European level. No a single member state can do this, no more than the others in a national perspective. For this reason, it was decided to, for instance, to use a very important instrument that the European Commission is preparing, which is the European Health Examination Survey. That will be a very extensive survey that will be implemented in the member states with a total sample of around 4,000 persons per member state, which represents an enormous amount of people to be surveyed. And in this health examination survey, a module on cognitive decline will be included. That will probably permit to know more about predictability of the dementias in the near future. Also, in this joint action, good practices in relation to treatment for care, and care, as I said, rights for dignity and people with dementia will be included. This joint action is led by the Haute Autorité de Santé in France and contains several work packages for which Luxembourg will be one of the leaders, I think, in some part of this joint action, also Belgium, also Germany. Several member states are working very hard to put in place this joint action, and I suppose that the starting of the works, of the real works, will be probably at the beginning of the next year. And it will be, as I said, very clear objectives: assessment of available population basic epidemiological studies, definition of the best criteria on best practices for improving the collection of epidemiological data, current recommendations for the diagnosis of dementia and diagnosis systems, assessment of practices of care, practices in training, what can be done also in terms of good practices in assessing competence of cognitively impaired elderly people. These are more or less the objectives that could be implemented via the joint action. Refers to epidemiology, to early detection, to good practices, to training, to rights and autonomy. In the slides, there is not what was impossible to obtain from the member states. I have been present in the discussions in the Council, in the discussions for preparing the joint action, and what is not in the slides is what was refused categorically by the member states to put in together. It was 3 or 4 words that were practically forbidden during the discussions with the member states. One, for instance, was insurance dependency. I know that Pflegeversicherung, assurance dépendance is very usual in 4 member states, but in the other 23, no, and it was categorically refused to introduce in the Council conclusions or in the Commission communication any reference to the insurance dependency or any schema like this. Another word that was not very well celebrated by the most part of member states was national dementia strategies. You know that we have at this moment, in fact, only 2 member states, France and England, Scotland, having a national plan on dementia, plus Norway, which is not part of the European Union, and others that are planning to have initiatives similar to plans in the member states. But to put in the conclusions of the Council or in the Commission communication the expression national strategies, it was refused by the most part of member states. A third word that was also refused for the most part of member states is the word standards of care. Standards of care, every member state for the moment prefers to have their own standards of care, and it's difficult for the moment to introduce this discussion in a European dimension. Then, if these things that probably you consider necessary are not in the Council conclusions, are not in the Commission communication, are not in the joint action, it's not the fault of the Commission. For once, it's not the fault of the Commission, but it's really because it was impossible to introduce this with a consensus with the most part of member states. This joint action, as I said, will be very relevant and will permit for the first time to introduce also indicators for really evaluating the implementation of these, if you want, modest objectives, but at the same time very important objectives in terms of a common policy or a common approach in some aspects of Alzheimer and dementias. And that's something that really we should, in any case, celebrate. We have this joint action, and we have a second initiative that is running at the same time from the European Commission. It's the recent creation, after December 2009, of what is called the European Parliament Interest Group on Carers. Carers is one of the most important parts of the treatment of the following of Alzheimer. I don't need to explain this to you. And one thing that is important at this moment is to permit that certain European resources, that for instance is the European Social Fund, could be used also for the training of the carers and particularly for the training of the carers of people suffering from dementia, suffering from Alzheimer. There are current discussions on this, there are advanced discussions, and I think that we could be really optimistic in terms that the recognition of the role of the carers at the European level will be something real in the coming times. There is also something that will happen very soon, because 2012 is not so far, and 2012 will be declared by the European institutions as the European Year on Active Aging and Solidarity Between the Generations. That's something important because that will permit also not only to have a good word, a good poster to put in several places, but it's really, the Commission is considering at this moment to contribute with a very important financial basis to an initiative in this European Year of Active Aging and Solidarity Between Generations. Unfortunately, I have for the moment, not possibility to tell you much more because internal discussions are ongoing, and it will be decided very soon which will be the exact content of the big initiative that the European Commission wants to take in order to really support this 2012 year. But I think that in this sense, we can expect good surprises or good news in the coming months. Another thing that is important also in the activity of the Commission was presented in a session, I was present in this session, it was extremely interesting, is the implementation of the project called PharmaCog, Prediction of Cognitive Properties of New Drug Candidates for Neurodegenerative Diseases in Early Clinical Development. The coordination is Université de la Méditerranée, Marseille, France, but also GSK, the company GlaxoSmithKline, which was leading the presentation in this session here during the Congress. And that's also important because it's the first time that really a partnership has been created between the European Commission and the European Federation of Pharmaceutical Industries and Associations, including also a consortium with universities, research centers, etc., etc. And this big consortium will work with a significant funding coming from the FP7, from the framework program of the European Union, the Innovative Medicines Initiative, which is one part of this FP7, and with the money coming from the different industry partners. That's important because really it is a real decision to really, I will not develop too much this because people had the opportunity to assist to this session, but it's very important in terms of really giving a new perspective and a unique opportunity to change the drug discovery process in reference to Alzheimer's disease and to accelerate the efficacy of the drugs to patients across Europe. I think that that will be essential. Also, from the side of the identification of biomarkers sensitive to the disease and the progress that can be done from this very important PharmaCog initiative. Then we have another initiative that I have mentioned before, the joint programming, which is the idea behind the joint programming. At this moment, today, only 5% of the research funds in Europe for dementia are European Union funds. 10% are intergovernmental conventions, sometimes bilateral, sometimes trilateral. And 85% of the resources devoted to research on dementia in the European Union are national. Then, as you can imagine, the risk, not the risk, the reality of duplication, triplication, etc., is a real risk, and it's a reality. What we need to do at this moment, and that was the origin for the creation of this joint programming initiative, is that 24 member states, 20 from the European Union, plus Albania, Norway, Turkey, and Switzerland, have accepted to put together these resources in a joint programming initiative and to try really to together decide which should be the priorities for the research on dementia. And that's really important because it's the first time that really we can put together not only the European resources, but also the national resources. Joint action for the public health, joint programming for the research. These two expressions to remember. And this work in the Joint Programming Initiative, which is also coordinated by the Fondation de la Coopération Scientifique sur la Maladie d'Alzheimer et les Maladies Apparentées in France, it's a big initiative in which, again, funding from the European Commission will be proposed, funding from the different member states will be proposed, and a synergy should be and will be established between the joint action in public health and the joint programming in the area of research for dementia. The priorities that for the moment, in a very broad way, have been established for this joint programming initiative are coincident in a lot of cases with priorities in the PharmaCog or priorities in the joint action. This is the reason for which something coordinated, the different initiatives, will be probably put in place in the coming times. But you can see that really all the member states, or these 24 states participating in the joint programming, have identified basic medical and social services needs in terms of research, in terms of coordination. In the long term, what is important to do is really to take something very clear in our minds. We have a public health approach, we have a research approach, we have a social protection approach, we have a pharmacological approach. But these four approaches for the problem of Alzheimer should work together, and should work together recognizing that aging of the societies, it's a real problem, that we need to really react in a coordinated way, and that the efforts that we modestly in the European Commission are trying to do is to coordinate these different actions. But of course, we are arriving also to the end of a certain period, because the health program was only for the years 2008-2013, the FP7 was only for the years 2007-2013, and the structural funds are also for the year 2007-2013. Very soon, the European Union, the European Parliament, the Council, the Commission will start discussions for what is called the new financial perspectives for the period 2014-2019. We have here with us today a Minister of Economy that probably will be associated to these discussions, but it's not only the financial part in itself, it's that the decision that will be taken in the field of the financial perspectives of the Union for the period 2014-2019 is the basis for the future content of the fourth health program and the FP8. And what is important, because here essentially you are patients' organizations, and one of your, between brackets, obligations is to lobby. But what you should do is to lobby for the third health program and the FP8, who should recognize Alzheimer's disease and dementias as one of the priorities. The discussions about the priorities in the future third health program will be very complicated. We are not in a very good economic and financial context, as you know very well, but it's not only this the problem. The problem is also that the health context is really a very complicated context in which several priorities are competing sometimes, or are sometimes not clearly identified as which should be the first, the second, the third, the fourth, or at least in which level of equal importance they should be. Dementia should be a priority in the fourth health program. Dementia should be a priority in the FP8. The Commission is convinced about this, but the Commission is not the budgetary authority. The budgetary authorities in the European institutions are the Council, Member States, and the European Parliament. And this is the reason for which I said the action of the lobbies is sometimes very important. And you, Alzheimer Europe, and you present here today, you have proved a lot of the times that you can be an exceptional lobby, that you can be exceptionally efficient in helping the European institutions to really adopt what is necessary to have as priority. And I think that a common effort between the European Commission, Alzheimer Europe, and all the national partners should be really the guarantee of the success. Thank you, and I hope that these days have been really useful for you here in Luxembourg.